everyone, it's Dr. Bishop here. This video goes over a validity checklist for an article about therapy. To review, a patient approached us about a study he had seen in the news. We found the article and are starting to review it. We came up with this PICO question. Among patients with severe heart failure, does spironolactone versus placebo improve survival? And we learned the 3 steps of critical appraisal. In this video, we're going to learn how to answer the first question: are the results valid? In order to answer this question, we will use something called a validity tool to help guide us. You can find the validity tool on the JAMA Evidence website. Go to the User's Guide tab, and then to the right sidebar to the Critical Appraisal worksheets. We're going to look at one for therapy. You need a username and password to access these worksheets. We also have tools as PDFs on Canvas. Let's quickly go over the checklist and then we'll go through the article in more detail. The purpose of the checklist is to make sure the researchers minimize the amount of bias in their study. It's broken into 3 categories. First, did the intervention and control groups start with the same prognosis? Second, was prognostic balance maintained during the study? And third, was this prognostic balance in place when the study was complete? Let's look more closely at all of these domains, starting with the first one. So did the intervention and control groups start with the same prognosis? To answer this question, we're going to look at 3 specific aspects of the study. First, were the patients randomized? Second, was group allocation concealed? And third, were patients in the study group similar with respect to prognostic factors? Let's start with the first question and go to the article to see if patients were randomized. To find this information, we are going to go to the methods section of the article. If we read through this section, we can see where the researchers described randomization. They write, after the initial evaluation, patients were randomly assigned in a double-blind fashion to receive either 25 milligrams of spironolactone once daily or a matching placebo. So if we go back to our checklist, we can give that answer a check. Continuing on, let's take a look at the second question. Was group allocation concealed? What does that mean? Allocation concealment means that the person enrolling patients does not know what the next treatment allocation will be. For example, if you are a doctor enrolling patients, you do not know and cannot predict whether the next patient will be in the treatment arm or the control arm. If you knew what the next allocation would be, you might choose not to enroll a patient to avoid having them go into the control group or the treatment group. I've actually read through the article and couldn't find any reference to allocation concealment. The researchers talk about blinding, but not specifically allocation concealment. If we go back to our checklist, we can give that question a question mark because we don't know the answer. Continuing on, let's look at the third question. Were patients in the study groups similar with respect to known prognostic factors? Let's go back to the article. To answer this question, we have to go to the first table, the Table 1. This usually describes the characteristics of patients in the control and treatment groups. This table looks at a number of characteristics that may impact death, like a patient's age, their gender, their race, the severity of their illness, and other medications. We want to ensure that characteristics that may impact the outcome, in this case characteristics that may impact a patient's risk of dying, are similar between the control group and the treatment group. Sometimes this table will show p-values to show that there are no statistical differences between the groups. In this case, they do not show p-values, so we do a quick run-through of the table. I've already reviewed the table, and it looks like the patients are generally similar in both groups. If we go back to our checklist, we can give that question a check mark. Let's move on to the next set of questions. Let's look at the next set of questions. Was prognostic balance maintained during the study? This question gets at the issue of whether patients in each group were treated similarly as the study progressed, aside from getting the study treatment. The key way we ensure that patients were treated similarly is to make sure that patients, clinicians, data collectors, and data analyzers don't know which group the patients are assigned to. This is something called blinding. And we ask ourselves the question, to what extent was the study blinded? If we go back to the methods section of the article, the researchers write, after the initial evaluation, patients were randomly assigned in a double-blind fashion to receive either 25 milligrams of spironolactone once daily or a matching placebo. The term double-blind is one that you will see often in the medical literature. Most often, this term means that patients and researchers were blinded. For patients, in the case of a drug trial, the treatment pill and the placebo pill might look exactly the same, so patients don't know what they are getting. Researchers might collect and analyze the data before they know which group is the control group and which is the treatment group. What is challenging about the term double-blind is that we don't know whether the 4 groups listed on the previous slide were blinded in this study. What I would say is that blinding was adequate, but it's unclear whether it was really perfect. If we go back to our checklist, let's give that question a check mark. The final set of questions asks, were the groups prognostically balanced at the study's completion? There are 3 specific questions that we will answer to get at this domain. First, was follow-up complete? Second, were patients analyzed in the groups to which they were first allocated? And third, was the trial stopped early? Let's look at the first question. Was follow-up complete? When we look for completeness of a trial, we want to know what happened to every patient. In the case of this spironolactone trial, we'd like to know whether all 1,663 patients lived or died. The validity of a study goes down if we don't know the outcome for patients at the end of the study. If we look at the methods section, the researchers write, all patients remained in the study so that we could track hospitalizations and deaths. If we go back to our checklist, we can give that question a check mark. The next question is, were patients analyzed in the groups to which they were first allocated? This refers to a term called intention-to-treat analysis. Intention-to-treat analysis is a really important concept. Remember, the power of a randomized controlled trial is that patients are randomly assigned to the treatment group or the control group. The randomization reduces a lot of bias in the study. As a result, you have to analyze patients in the groups that they were randomized to. Even if a patient is not compliant or didn't take the treatment, or if they were in the control group and ended up getting the treatment in a different way, they are still analyzed in the groups to which they were randomized, because you have to keep the power of the randomization. Let's go back to the spironolactone study. If we scroll through the methods section and look at the statistical analysis section, the researchers write, the analysis of death from all causes included all patients according to the intention-to-treat principle. Going back to the checklist, let's give that question a check. The last question is, was the trial stopped early? This question is important because sometimes trials are stopped early because there is an apparent benefit or harm. But if a trial stops early, it may be that there is an early benefit, but the longer-term benefit is unclear. For that reason, it's helpful to know what time frame the researchers had in mind. If they want to look at 1-year mortality and stop a study after 1 month, we might really question whether there is a long-term benefit. Studies are stopped early, however. if it looks like the benefits really outweigh the risks, or vice versa. In fact, the spironolactone trial is an example of a study that was stopped early. In the results section, the researchers write, "At the 5th planned interim analysis, the observed effect of spironolactone on the risk of death from all causes exceeded the pre-specified critical z-value. Hence, the trial was stopped on August 24th, 1998, after a mean follow-up of 24 months, and on the recommendation of the Data and Safety Monitoring Board." Going back to our checklist, let's give that question an X, because the trial was stopped early. But it does appear there was a long follow-up time of 24 months, and the trial stopped early because it looked like the benefits really outweighed the risks. Now that we've completed the validity checklist, let's pull everything together. Looking at our full checklist, we can see that the researchers minimized bias by randomizing patients, by blinding patients and researchers, and using intention to treat analysis. Patients were also similar in the two groups. We were unsure about allocation concealment, and were concerned that the study was stopped early. So the big question is, were these results valid? This brings up an important point. Validity is not a yes or no answer. Instead, validity is a spectrum that ranges from weak studies to strong studies. It's up to you to decide where each study falls on that spectrum. For this study, I personally feel it was a strong study, and I'm willing to believe the results, even though I didn't have information about allocation concealment, and even though this trial was stopped early. Now that we've decided that the study is valid and we believe the results, it's time to interpret those results.